These next ones are called chin tucks, and it's basically just kind of creating a double chin to strengthen the muscles in the neck. So what you're gonna have the patient do is they just kind of bring their head back like this, and they hold it for 10 seconds, 10 times. And it's important that they don't like just bring their head back like this. You want them to just make that double chin. All right, this is called the upper trap stretch. And what you're gonna have the patient do is just kind of lean their head to the side. They can use their hand to kind of deepen the stretch if they need to. And they just hold it for 30 seconds, 3 times. When doing this stretch, it's important that they're not bringing their shoulder up because that defeats the purpose. So they can either hold on to the side of the chair or sit on their hand just to keep their shoulder down and get that stretch. All right, this is called the levator stretch. And what you're going to do is just kind of look down into your armpit, and you can use the hand if you want to deepen the stretch, and you hold it for 30 seconds 3 times. And it's important that you don't let your arm come up, your shoulder come up as you're doing it, so you can grab onto the side of the chair or sit on your hand, and that just keeps the arm in place to get the good stretch. All right, this is the SCM stretch. Also, you might see it as the scalene stretch. And what you'll have the patient do is kind of lean their head to the side and a little bit back, and they'll just kind of look up, and they can use their hand if they need to deepen the stretch and hold it for 30 seconds 3 times. When they're doing this one, you want to make sure that when they look up that they aren't bringing their head up, that they're still getting the side bend, because that will get the stretch through here.
All right, so this is 6-way isometrics. You're gonna have the patient use their hand and kind of use it to resist. So first you're gonna have them try and turn their head to the side like this, but there's no actual movement. They're gonna hold that for 10 seconds, 10 times, and do the other side. Then they're gonna try and do that forward, 10 seconds, 10 times, back, 10 seconds, 10 times, as well as turning their head like this and like this. So you can have them alternate between all of the different directions. One helpful thing for patients to differentiate between this and actually rotating the head is to have them already just rotate it slightly and then do the isometric turn, and that way they can make sure they're doing this instead of this. All right, so this is the UBE, or the arm bike, and you can see it written either way on the patient's chart. Often we use it for a warm-up for those with shoulder injuries who are more advanced in their recovery. What you're gonna have the patient do is they'll just sit down in this chair, and they'll grab a hold of these handles, and you've got a little timer right here. They're just going to go back like this for 3 minutes, and then they'll switch directions and go forward for 3 minutes, and it's really loud.
All right, this is called beach ball, AAROM. And what you're going to do is you'll take our beach ball here, and it's not inflated all the way. You just want it inflated enough that your hands can't quite touch each other when you put pressure on it. You'll put it inside a pillowcase for the patient, and then set it on the table. And then you'll have the patient lay down with their head on the beach ball, and they'll just turn their head to the side and hold it for 5 seconds. And then they'll slowly go over to the other side and hold it for 5 seconds. And they'll do each direction 5 times.